latest coming in. The Prime Minister has met with secretaries of various ministries today in the wake of increasing number of Omicron cases in the country. Maharashtra has recorded the most cases so far at 88. In a letter to states and union territories, the centre has also asked local authorities to bring back some restrictions, including night curfews, restrictions on large gatherings and curtail attendees in marriages and funerals. The number of people in offices and public transport should also be restricted as per these new guidelines. My colleague Samir Dikshit joins us with more. Samir, what's the latest from the Prime Minister's review meet on COVID-19?
At a time when more than 240 Omicron cases have been registered in India in almost 16 states, PM Modi chaired an important review meeting related to COVID-19 and the Omicron threat in the country. So PM was apprised with the current situation related to Omicron as well as the vaccination exercise, the pace at which the vaccination is going on. That was apprised to the PM by Union Health Ministry. Also, a detailed presentation was given related to the availability of drugs, medicines, medical staff, hospital, the ICU beds, liquid medical oxygen. So the availability of these important aspects that was apprised to PM in this important review meeting that is being chaired by Prime Minister Narendra Modi. The lockdown might be not a solution that is being looked upon by central government, but yes, sources have informed that central government will once again appeal to all the state government that they can adopt for strict measures to curb the spread of Omicron. And in this direction, we have already seen a couple of states taking quite important steps, like Madhya Pradesh government has imposed night curfew in the state. Maharashtra could be another state where we can see some strong action being taken to curb, to restrict the spread of Omicron. But yes, there is a couple of good news as well. Out of the 240 plus cases of Omicron, 104 cases have been properly treated and discharged from the hospital. More than 60% of eligible population that has been covered with the double dose or full vaccination program. 140 crore plus vaccines that has been administered in country. So yes, in between all this good news, government is in a quite cautious stage, and government is looking that with the couple of festivals like Christmas or New Year, this should not become a reason in the spread of Omicron, and government has clearly directed to states that they should surely adopt strict measures to curb the spread of Omicron in the country.
Well, Maharashtra Chief Minister Uddhav Thackeray is expected to hold a video conference meet with his task force for COVID-19 later tonight. One of the prominent members of that task force, Dr. Shashank Joshi, is with us on the show right now. Dr. Joshi, thank you as always for speaking with us here on the India Development Debate. I want to talk about Mumbai numbers for a bit. Over the last 3 days, we've seen them bumping up quite significantly. 400 odd yesterday, 601 today. Is this being fueled by the Omicron?
That's unlikely. I think Mumbai always had active virus in circulation. And in absence of a pandemic situation, it was getting endemic. So Mumbai always had 200 or 300 numbers coming up. But a month back, the numbers had substantially declined. And our test positivity rate was hovering around 0.4%. And today the test positivity rate is 1.5%. So clearly in the last 2 or 3 days, there has been a significant increase in the numbers. Of course, the testing has been ramped up. So when the testing gets ramped up, obviously the numbers go up. But here the test positivity rate from 0.4 also has gone to 1.5. And we know there is wedding season and festive season around the corner. And people are back in the economic as well as educational wings. So all that has happened simultaneously. So we need to ensure that we have to put COVID appropriate behavior and protocols in place. And we know that the strongest weapon against whether it is Omicron or Delta, both these are active viruses in circulation. Omicron is still sporadic as far as India is concerned. So we do not have cluster outbreaks except one which was there in Mumbai in office. Predominantly, the virus is still the Delta derivatives in the genomic sequencing, what we are yielding. But having said that, Delta is still in circulation. And this rise is not something to be happy about. It is time for people to be more vigilant, more careful and more cautious. The only thing is Mumbai is also recording 0 deaths in the last couple of days, which is a good sign, which means the disease severity is much less. But at the same time, we can't have sheer high numbers coming up very fast and quick. So that is the good sign. And I think we will have to be more vigilant, particularly around the festive season and the wedding season around the corner.
what is the reason then? What is the reason now for the high numbers, Dr. Joshi, and what is our process in Maharashtra to determine how many of these are Omicron cases? Is every positive case going for testing to determine whether it's a case of an Omicron infection?
So all the travel related imported cases are going for genomic sequencing. I have been consistently doing genomic sequencing from each district of state of Maharashtra for a long time, since the month of May, with a collaboration with the CSR lab in IGIV in Delhi. Also simultaneously, we have a lot of support from NCCS, NIV, TIFR, plus labs of BJ Medical College of Dr. Karyakarte and the Kasturba Medical College here, Kasturba Hospital. So we are consistently doing genomic testing. We can't do genomic testing for every RT-PCR which is coming positive. Also remember that RT-PCR is only a tip of the iceberg, because a lot of people are doing self-testing, not reporting, and self-isolating. So if you are having flu-like symptoms, please test, whether it is a rapid antigen test or a RT-PCR test. We insist that you do RT-PCR test and report and self-isolate, protect yourself, protect your near and dear ones and others. But the only silver lining is that the disease appears to be mild. Even if it is Omicron, all the cases which were travel related and which were reported in Maharashtra and Mumbai, most of them have fully recovered, though they were in doubly vaccinated cases. But the current severe disease or the deaths are being reported predominantly in the partially vaccinated or on the vaccinated group. So that is the only challenge which is there. But we need to be vigilant. Clearly, we have seen a tremendous amount of crowding and gathering and festive season, and that something needs to be controlled. We are not saying that we need to stop anything, but at the same time, we will have to draw a line and self-regulate our behavior in terms of double masking, reducing the number of crowd and congregations. Whenever we unmask, particularly in eating, we'll have to be more cautious and careful.
Yes.
And that is something which is in our hands. So I think it's important to self-protect and protect people around us, because we cannot now sow the seeds for another cluster outbreaks. And these cluster outbreaks cannot, ultimately conglomerate into a wave. The whole idea is that the Delta wave seemed very unlikely, the third wave. But with Omicron coming in, it will change the equation, because we know that the rapidity of spread of Omicron is very, very fast. And that is the worry and scare which we all have, the community outbreak of Omicron. Currently, it appears to be unlikely. I think currently it is the Delta in circulation and Delta derivatives in circulation. We have consistent report week after week, but the current driving, it appears to be unlikely that it's Omicron. It's basically also a reflection of high testing which is happening.
Okay. Tell me about restrictions, sir. Are you recommending restrictions? We saw what the central government put out to states, and they're talking about bringing back night curfews. A couple of states, Gujarat and Madhya Pradesh, have already done that. Can we expect that to happen in Maharashtra? Can we expect some more restrictions like you had earlier for how long shops are open, restaurants are open? Would you be going in that direction with something like Omicron?
So I don't think that is an administrative decision. So medically, we don't give such recommendations. The administrators take these calls, and these are based on the local prevailing situation. Currently, as I said, that we are concerned, we are cautious. There is definitely a blip which is of concern to be noted for, but I am not reasonably certain that any major restrictions will come in. But people will need responsible behavior, and if that doesn't happen, then more vigilance will be there, because we are also seeing a lot of gatherings, crowding, and also non-masking, and that will need some zero tolerance for COVID appropriate behaviors. From a science standpoint, we will recommend that doubly vaccinated people and double masking is the key, and that is what we should do appropriately. We cannot stop economic engines or educational engines. At the same time, if the numbers explode and there are likely to be high congregation points, then probably some restrictions may be put by the administration, but that will be an administrative decision, case to case, district by district.
Yep. Thank you so much, Dr. Joshi, for joining us ahead of that crucial meeting that is going to take place with the Maharashtra Chief Minister and the COVID Task Force. I know three people who have been listening very carefully to what Dr. Joshi has been saying, and they are my next guests on the panel, because this has come as a party pooper, as a complete negative for an industry that has been reeling through most of the pandemic. I'm talking about hotels, restaurants, clubs. The whole F&B segment has been hit badly, and Christmas New Year is a crucial time for this sector especially. Now, you've seen in all the major cities, I would say Mumbai, Delhi, Bengaluru at least so far, there have already been curbs that have been announced on gatherings during Christmas and New Year. What is going to be the impact? To speak on this, I'm joined now by Pradeep Shetty of FHRAI, that's the Federation of Hotel and Restaurant Associations of India. Zoravar Kalra, founder and MD of Massive Restaurant, is with us on the show. Anurag Katriar, Trustee of National Restaurant Association of India, also with us on the show. So welcome to all of you, and thank you so much for speaking with us. Mr. Shetty, let me begin by getting your take. With the latest coming in, we know that numbers may increase. Are you worried that there will be fresh restrictions, especially on restaurants? And what has been the impact of the curbs for Christmas, New Year gatherings?
Yeah, hi. So yes, we are very worried because the numbers were looking good start of the season and start of the month. In fact, the industry was looking forward for a very good New Year and Christmas, and it's all of us have been missing celebrations. And an industry which was otherwise shut down for almost 10 months, suffered the maximum restrictions. We were really looking forward for a very good season. Now, this has become a dampener, a certain dampener. So all the plans have now been taken back. Restaurants everywhere, as you already mentioned, there are curbs. So we are disappointed. Of course, we are with the government with the kind of precautionary measures they are taken. We are only worried that they don't take it too far so as to strangle the revival which was happening right now. So at 50%, otherwise also operations are very difficult to happen profitably. And so far as hotels are concerned, the international arrivals which were scheduled to be opened up, that the tourism that was also being deferred. And city hotels are suffering very badly, and you know these events and special events and occasions were a ray of hope to garner some revenue and to ensure that the employers, the employees, and the properties could be managed. But all of this is definitely going to have a big impact on the New Year celebrations. I'm very sure about that.
Yeah. Zoravar Kalra, can you break it down for me? How crucial are these last few days of December for the business as a whole? The good thing is that the festive season earlier with Diwali and all of that had enough people coming out, and people were able to come out. Restrictions were lifted. But are you worried that it will come down again? People will be afraid to come out and they will not be allowed to come out. And what would the impact be for a business?
Yeah, so as Mr. Shetty said, it is definitely a cause of major concern. To put numbers in perspective, December accounts for 20 to 22% of the annual sale. So December is peak season. It's the season that most restaurants and hotels are able to generate solid revenue and some decent level of profitability. As you know, the industry has been beleaguered. It's been one of the heaviest hit over the past 2 years. 30% permanent closures of restaurants in India, 25% complete loss of workforce permanently. So there's a huge problem that the industry has faced. We are a major industry. We contribute between 2 to 3% of India's GDP. We're also the second largest employer of human capital in India after agriculture. So that being said, obviously, number one priority for everybody has to be to act responsibly. And we understand the predicament that the government is in, but we also do not want to be singled out. We don't want to be the industry that is singled out independently as the one that takes the brunt of the curbs. The curbs are necessary. I think everybody needs to be responsible, the patrons as well as us as the restaurateurs. But this is the festive time, and this was the one time we were all looking forward to recover some small part of the huge losses that the industry has incurred. And the biggest fear right now is that, forget the past 10 days. And by the way, these last 10 days of December account for, over 60, 70% of even December's revenue. So if you do the math, 14% of the annual revenue, 12 to 14% of the annual revenue comes in the last 10 days of December. So it's a very critical period. It's unfortunate this is happening. We only hope that the government is rational and also that proper information is disseminated. You have to understand the Omicron definitely spreads very quickly. And I just got off a call from a very big doctor here in Gurgaon. And he told me that even though spread is very quick, it is not something that it has mild symptoms, and the hospitalizations and deaths have not increased. So I think if proper information instead is, as Dr. Joshi said before, people follow basic COVID protocols, then we can still continue with the current slew of restrictions and not impose new ones. If new ones are imposed, the restaurant, hotel, and aviation industry is going to suffer even bigger. And I'm telling you, there's going to be a bloodbath, and you're going to see a lot of closures, a lot of people losing jobs permanently, lives being destroyed. So I'm hoping that first importantly, there is no further spread. We don't want a replication of the second wave. That was heartbreaking, and we all must first consider that to be the top priority. But I'm also hopeful that sense prevails and science and information is used as the crux to create new restrictions.
Yeah, so we're already seeing the move towards night curfews. Anurag Katriar, what is the worst case scenario over here? And, you know, Zoravar talked about being singled out. Do you think that restaurants tend to be more vulnerable because this is one place where you have to pull down your mask to eat? There is really no way around it, which from the policy standpoint makes it a space where infections can spread more easily.
Thank you, Tamanna. I think, you know, first of all, I definitely second what Zoravar just said, that we have been singled out right from the beginning of the pandemic. And I don't understand why a theater with 100% capacity can operate, public transport can work, you know, exhibitions can happen, but restaurants cannot work. Airlines can work. In airlines also people do eat and they do take off their masks. So I definitely feel that we have been singled out for whatever reasons best known to the administrators. I don't want to get into the reasons for it. But I must say that, you know, Christmas and New Year's, while they contribute hugely to the restaurant revenues, this is also the time which we were hoping last year and this year as well to work as a catalyst to boost consumption within the sector. Unfortunately, in both the years, last year and now, we are seeing further restrictions coming in, and which will again, it is going to have an adverse impact on the sector overall. It's, you know, this industry is hanging by a small thread. It is not yet out of the rut. It is one of the worst impacted industry. And at this stage, we need little extra support. We need little extra consideration from the administrators of the government, and not being singled out. This is definitely a case of huge concern for us. We heard about Mumbai, we heard about Delhi, we heard about Bengaluru. We are hearing Hyderabad is also coming up with certain restrictions. And I don't understand. If you are working with 50% capacity, why is it safe to dine till midnight and unsafe after midnight? I don't see the logic. In fact, the longer you keep the operating hours, lesser the chances of crowding. And I think somewhere we are missing this very important thing. 50% capacity itself is a huge problem for us to operate profitably. Now, on top of that, you are restricting hours, and now a time when everybody really, you know, the sentiments really improve, you are bringing in more restrictions. It's a very sad state of affairs, and I'm not going to mince my words today because I was really hopeful that this year this last weekend will work as a huge catalyst to boost consumption in the sector. That seems to be going away with all the restrictions coming in and the talks that we are hearing within different state governments.
Yeah. The mood has changed, no doubt, in the last week or so. And the number of cases rising is testimony to that. So now let's look at what can possibly happen next. And Mr. Shetty, let me come to you on this. Double vaccinated people being allowed in is possibly something that state governments could contemplate. We know the state of Haryana has done this, that they're allowing only double vaccinated people in all public places. Do you envision a situation where they do that in restaurants as well? restaurants and hotels?
In fact, that is already happening in Maharashtra and in many of the states. In fact, our entire staff workforce in hotels and restaurants are fully vaccinated. We were one of the first industries who really took the effort to vaccinate all our staff.
I'm talking about customers.
Yeah,
I'm talking about diners and patrons.
So that's
Yeah,
exactly
I'm
what
talking
I'm
about
saying.
diners and patrons.
That is already taking place in many states. In many states, only fully vaccinated patrons are being allowed. And if that be the case, I think we would welcome that. As long as our fires are burning, as long as we are able to manage our employees and manage to pay them, and as long as the business keeps running, we are very happy. We really do not want a second wave scenario or a first wave scenario in which collectively we were shut for more than 10 months. This one, the third one, if it goes to that level, it's going to be catastrophic. So we are absolutely okay with reasonable restrictions, with the proper rationale if things are applied. As Anurag just said, that there has to be reasonableness to any restriction that you bring in. What is good for me, what is bad for me cannot be good for others. So if something is happening in other industries but it is not being allowed over here, it is really serious. So you may have a large venue, but they are still putting a cap on the number of people that gather. So there are venues which can take about thousands of people. Why aren't you having? It's a wedding season that is really affecting the industry, and there is a whole big economy associated with weddings and meetings and mice. Similarly with the operation timings, when you reduce the capacity, but again you reduce the timings of operation, that has a telling effect on the revenue. So that also needs to be, in fact, staggered timings are going to help. So we feel any reasonable restrictions are welcome, as long as you don't shut us down, because the problem with shutting down is that there is no compensation. You shut down and then you have to fend for yourself. Then you have to continue, because the government then says continue paying your employees, and there is no relief whatsoever from any corner. So I think largely we would welcome anything which is reasonable, as long as the business is allowed to go on. And there are so many new impositions that local administration comes. Even within a state, there are different levels of restrictions coming up at different district levels. Mumbai said, so there will be no gatherings of people. Now, all this plays with the sentiments of the patrons who want to come in. Although there is no real restriction on people coming and gathering in a restaurant, but all these measures, which I really don't know how much they really matter, but they tend to bring the sentiments down in people to travel. Now, for an example, the weekends are, this New Year has been particularly bad for resort locations, I must tell you. Otherwise, New Year's is supposed to be a very smash hit, but this year, because of what is happening, we are looking at cancellations in many of these resort and holiday locations. That's because of the sentiments going low, the fear, and so much of news and so many curbs. So I think as long as reasonable restrictions are allowed, I think we would be fine with that.
Now, give me some more detail on that, Mr. Shetty, about the cancellations in hotels and resort locations and holiday destinations. Which areas are you seeing cancellations in?
So in Maharashtra, places like Lonavala, Mahabaleshwar, in fact, a lot of places in Goa, which otherwise would have been full or sold out by now, that has not happened yet. So in fact, large events have been cancelled, because a lot of these occupancies of these resorts are also connected to the large events that happen over there. Since there are no events, since there is restriction on travel, etc., in terms of the number of tests one has to do, and the whole fear of this fast spread and so much of news, and now even the center has rushed in to issue certain advisories. And while they issue advisories, they also have given a lot of leeway to the states and the local administration to impose anything further and more than what they are advising. So in resort locations, especially across the country, it is not business as usual. They are usually sold out a month before the year end, but that is not the trend what we are looking at. We increasingly having reports of cancellation in every part. In the north, in the Himachal, in Rajasthan, it was doing well up to the December second week. Now it's not looking that good. Goa, Mahabaleshwar, Lonavala, and even in the Union territories, we've heard cancellations and very low key bookings that are coming up right now.
Yeah, so definitely a bad time for the business. You know what's really incredible is that 18-20 months down the line, we're back at square one with a new variant. Zoravar, what would you suggest as someone in the industry as a middle way out? One suggestion that we talked about is having only vaccinated people come in if that is safer. You're already at a 50% capacity. What more can be done to make sure that at least the business keeps running?
Zoravar is on mute.
Zoravar, I think you're on mute.
Yeah, sorry about that. I think dissemination of proper information, I think that's absolutely critical. People definitely should not think that the COVID is over. It's not over by any chance. It's definitely, hopefully, on its last legs. The Omicron, though very, very, contagious, is very mild in symptoms. I think one of the key things could be to extend operating hours. I think I'm going to take a radical, direction here and say that extend operating hours rather than reduce them. 50% occupancy has always been in play. That hasn't changed. People just have to be more responsible. We have to be responsible as the people serving them. They have to be responsible in walking out. Do not walk around without masks. Do not take that for granted. Even when in an aircraft, one thing Anurag Katriar said is that if the airline industry can have 100% occupancy, why not the restaurant industry? There you're sitting literally in an aluminum tube right next to each other, and you have to take down your mask to eat food or drink water. I just think, any unnecessary, undue restrictions now will create more damage than good. The science is there. Hospitalizations are not increasing. Deaths are not increasing. The Omicron variant, as Dr. Joshi said just before we started talking, he said that they are still a very, a small percentage of the overall infections within India. I think I would hate to say this, but maybe some more travel restrictions from people coming from outside. Right now, India is in a better position than most of the world. I think we've been able to curtail this, right, at least so far. And I hate to say this for the travel sector, I know it's going to be bad, but maybe ban some flights from coming in. I think that could be one way to contain the spread of the virus within the geography of India. But you can't stop the economy. This is an economy now which has recovered one of the fastest. If you again put a stop to it, how many people will come out of it alive? Already some of your favorite restaurants, some of your favorite businesses are already out and shut and down for the count. If you impose another lockdown, you're just going to make things worse, and it might actually create more deaths and more problems than the virus itself. So I think rationality, reasonable behavior, and the use of proper information to make restrictions or to remove them is, I think, necessary at this time.
So another lockdown or massive restrictions are hopefully unlikely. We didn't even see them after the second wave, even though that had a huge toll on lives. But for the restaurant business, yes, there were restrictions of timings. At least in Mumbai, we had them only till 4 o'clock. Then it was extended. Anurag, are you hoping for a dialogue with local administrators to at least find a middle path so that, the kind of employment that your sector generates also continues?
We have always been open to dialogue. In fact, in one of the meetings a few months ago with the Honorable Chief Minister of Maharashtra, we had offered to be a part of any discussion on decision making. Please understand, we are also very responsible corporate citizens. We are with the government in this fight against pandemic. All we are saying is, let's impose restrictions or the operating procedures little more reasonably. For example, you just a little while back you said, well, how about allowing only double vaccinated people? It's already happening. Now my view is, if you're allowing only double vaccinated, why have 50% capacity? Why not 100% if everybody is fully vaccinated? These are unreasonable restrictions. We need to look at it progressively. The attitude of the government has to be, let's see how we can make it better for the industry as well, without compromising on the fight against the pandemic. And we have always been a part of that process. We have always been a part of that effort, and we will continue to be. We are absolutely will be more than happy to have dialogue with any government in any state of the country to come up with viable middle path on how to keep the virus at bay and continue the business in the right way.
Absolutely. The focus right now, though, for government, and that crucial meeting is going to start in about half an hour from now, is about preparation, containment, and tracking where the cases are really going. It's a big story that we've got our eye on. But for now, thank you so much to all of you for joining us on the discussion, on the debate. We'll take a very short